All right, ladies and gentlemen, welcome to another episode on Birth and Beyond. We trust you are doing well. Today, we are talking about another topic, which is hypertension and pregnancy. And even before we go into details, we realize that hypertension is all over the place. For every 10 people you pick, it looks as if you have 7 people who are hypertensive. And today, we're going to learn about what it is, what causes it, so many things. So join me, and then let's go with our midwife. Yeah, Portia, welcome to this episode.
Thank you so much, Mr. Edufo.
How are you doing?
I'm fine, thank you.
I like your drip, it's a simple drip, yeah?
Yeah, this is a simple drip.
Your hair color and then all that,
On point, thank you.
Okay, so, we've heard so many things about hypertension, right? And for me, the danger is that some people walk around being hypertensive, but they don't even know that they are hypertensive, right?
Yeah.
So that's why I feel like this episode is very, very important, that we need to understand. We learn a thing or two, just as we do every day. So before we go into, the pregnant women and then hypertension, for the normal person, what would you say hypertension is?
Okay, so as you've said already, a lot of people think so many things when it comes to hypertension.
Okay.
But today we want to break it down. So hypertension, a lot of people think that it's when the blood is too much. No. It's the pressure the blood exerts on the walls of the heart, like on the walls or the arteries in the heart.
Yeah, okay.
So when the heart constricts or contracts, the pressure it uses, or the pressure it exerts, is what we call blood pressure.
Okay, so before you go there, right, you said when the heart constricts, right? Can you give us just a brief, idea of how the heart works, so that for the normal person to understand when you say the heart constricts?
So when you put your head on somebody's heart or on somebody's chest, you could hear this sound, boom.
Yeah.
Boom.
It's a beeping sound.
Boom. So that is when the heart is contracting.
Okay.
Or constricting or contracting, anyhow you want to use it. So blood from, let's say, your lower extremities it comes from the lower extremities to the heart.
If you say lower extremities, what do you?
When we talk about the lower extremities is from your waist downwards.
Okay.
We've got upper, lower.
Okay.
Yeah. So when the blood enters the heart, the heart pumps the blood.
Okay.
So the pressure the heart uses in pumping the blood, that is when you hear the sound boom.
Okay.
So it pumps.
Okay.
So that is the pressure we're talking about.
Okay.
So if the pressure is too high, that means you put in stress.
Okay, so can we say that this is more like like a filtration system where water from, let's say, when you have a borehole, where you put a machine on it. So in this case, the heart is like like the machine in the body. Yeah. So it takes blood from the different parts of the body and then pushes it to other parts of the body. Yeah. Okay, so that's where you say, okay, from lower extremities all the way up, and then it pumps. Okay, that's fine. Yeah, but viewers, if you've also got any question, you can put it below. We'll be very happy to also, explain and help you understand all the issues we are discussing. Yes, so Portia, now let's go to this whole hypertension and then how it occurs, right? Now you've talked about the fact that when there's pressure on the heart, that is when we say that you've got like a high blood pressure.
Yeah.
So what would you say in terms of what causes it?
Okay, we have so many causes, a lot of things that are related to it, but first of all, I want us to know that we have a normal blood pressure.
Okay.
And we have a range that it has to be. And I always say we have the range, but some people have low blood pressure.
Okay.
And others have like a normal blood pressure. The reason why I'm saying this is me, for instance, my blood pressure is always like 100.
Okay.
99, 100 over 60. So as we go in there, the blood pressure is into two sections. We have the systolic and we have the diastolic.
Okay.
The systolic comes in when the heart pumps. That is what is being measured at the systolic. The pressure it ceases to pump. And when it relaxes, that is the second pressure. So that is the one which is always down. So we always have like 110/80, 120/60.
Okay.
Yeah.
So it's just the measurement where.
Yeah. So that is how it's being measured.
Okay.
That is how it's measured. So it's in two forms: the systolic and the diastolic.
So one is the numerator and the other.
Yes. So the systolic is when it pumps.
Okay.
And the diastolic is when it relaxes.
Okay.
So when you go to the hospital and you are being told, oh, your blood pressure is up, you ask, what is my blood pressure? So the person might say it's 140/this. But you don't usually confirm it just with one check. No.
Okay.
There has to be a series of it. And the reason why I'm coming to the causes, you asked me about the causes. Yeah. The reason why I try to explain is, my blood pressure is always 100 or 99/50/60.
Okay.
So if there is a case that I'm scoring like 130/100, it's a sign of high blood pressure.
Okay.
And this is because I know my blood pressure to be that way. Okay. So one thing we want to educate people is try and check your blood pressure at home.
Okay.
At first, those machines we used, it wasn't available. But now when you go to internet, you can order some from a lot of shops.
Yeah.
When you go to town, you can get some to buy. So you will know your blood pressure. In case it is high, you will know that indeed.
This is okay.
So the normal blood pressure is usually the up one, measures from 110 to 139.
Okay.
And the down measured from 60 to 99.
I see.
So when you fall between this, you are good to go. But over this is a high blood pressure, and below it is a low blood pressure.
Fantastic.
So causes.
Yep. Now to the causes.
The causes is what makes it so funny. A lot of people have different things to say about it.
Okay, tell me.
I know you've
because I know me. I heard when people say, oh, when you eat in the night, when you eat a lot of salt. I've heard so many things, right? But some people will say, okay, they have their history, and so but I just want, it's also good to understand from a health professional's point of view, right? So from practice, what have you seen to be the common causes?
So the common causes of blood pressure, most of the time you cause something hereditary.
Okay.
You get to take history of some people and you ask them, you realize that they are having high blood pressure. You ask them, has your mother had blood pressure before? Say yes. My grandfather died because of that. My close brother, somebody. So if you were like anybody around and you feel like your family have that history, you should take care of yourself.
So history is one of the major
history, like hereditary.
I see.
Yeah. And one other causes is like sedentary lifestyle.
Oh, break it down.
Sedentary lifestyle is broad, but you come to people who smoke.
Okay.
People who drink too much alcohol. Eating too much salt.
Okay.
Yeah, and eating that late. People have been talking about it. It can contribute to it.
I see.
The funny thing is, it doesn't have a real cause, but it has risk factors.
Okay. Okay.
It doesn't have like, listen, this is the main cause.
Main cause, yeah.
But it's so unfortunate that most of the health conditions we battle now these days do not have the real cause of it, but risk factors relating to it.
Okay, so there are things that you do that would, push you to.
Yeah.
That, okay.
And people who don't like to exercise. Obesity.
See. Okay.
Yeah. Stress. These are all causes.
I see.
I think I've talked about alcoholism already.
Yeah.
And it looks like, as for alcoholism and smoking, it looks like they are flaunting in all the health conditions we've been talking about. So if you drink too much, cheers mate, you have to stop. You have to try your best to cut it. Cut
it. I see. That's nice, because I heard so many things, right? But it looks like once you've also clarified that all these things contribute to people having it actually increases your chances of getting
yeah,
that high blood pressure. So at this point, I'm going to stop you here and say, if you have not become part of the family, please make sure you subscribe to the channel. We are on a journey to educating ourselves. Thank you. Let's continue the conversation. Yes. So what we've also realized that one of our subscribers said she's pregnant, right, and she didn't have any pressure before getting pregnant, but then when she went to the hospital, she realized that she was pregnant. She decided to go and check, and then after a few weeks she was diagnosed of high blood pressure.
Oh, bless her.
Yeah. So and she wants to understand, why is it the case?
Okay, so we're coming to pregnancy. it's huge. We have just hypertension in pregnancy.
Okay.
So we have somebody who is already hypertensive and goes on to get pregnant. So with that person, she's having
she goes into pregnancy with a hypertension.
Yeah. And we have something we call gestational hypertension.
Hey.
Yeah.
Break it down for me.
So with a gestational hypertension, that person develops the hypertension when she gets pregnant.
Wow.
Yeah.
How is that possible?
It's very possible. With pregnancy, you can't predict anything, it comes with it.
Wow.
Yeah, so there are some people, they have a normal blood pressure, but the moment they get pregnant, it comes with gestational hypertension. Yeah. And we have preeclampsia.
Okay.
That is when the hypertension in pregnancy has some additive to it.
Hey,
I'm coming to break it down.
Yeah. I mean,
so people with just gestational hypertension, you can be monitoring them. They would check a urine sample and there wouldn't be any protein in it.
Okay.
The urine will be okay, everything will be fine. So with such a person, you can just monitor the person throughout the pregnancy, like trying to give her the hypertensive medication, controlling her diet, not eating too much. Because most women, when they get pregnant, they start to, because they are craving for lots of things, they start to eat chunks.
Okay.
Which we all know that poor eating habit, not eating too much fruit, like eating like things that too salty food, like junk food and all those stuff contribute to you getting hypertension. So most women, these are most of the causes when they get pregnant, because they are craving for
different kind of things.
At 1 a.m. she'll eat noodles, the next minute she's eating ice cream, the next minute
some like
anything
pork. They like pork.
Like somebody I know, she'll be eating pork as at 1:30. So with the preeclampsia I'm talking about, the person will be having the high blood pressure, and when you check her urine, you see protein.
Okay.
And that is what causes an alarm.
Okay. So I want us to get it clearly, right? So with is it gestation hypertension, right?
Yeah.
That one, you don't see protein
in the urine.
But then with the preeclampsia, that's when you see protein in the urine.
Yeah.
Okay. And you said that, just for clarity, that the gestation one is also, as a result of lifestyle, mainly lifestyle, which can be controlled. Right? Okay, so now we're going to the preeclampsia. All right, talk to us.
So even with the gestational hypertension, if it's not controlled, it could lead to preeclampsia.
Okay.
Because it's the same high blood pressure, it's just the urine.
So talking about preeclampsia, right? In your line of work, what has been the cause? Have you realized any major thing that causes preeclampsia? We understand that it's the placenta, right, that stresses and then causes that. But what causes the placenta not to form well?
No one knows. Malformation is part of life. We all know, even with pregnancies, some people get pregnant and they take scans and they realize it's a malformation. And they're even asked to abort the babies and stuff. So as for malformations, you can't just predict it.
Okay.
And you can't know unless maybe there has been scans or you are showing signs and symptoms of something. That is when you know that, no, this is what is causing it. Let's try to take it off or focus on what to do next.
Okay, I see. Wow. So Is it also not the fact that, you know, some people, I'm just asking this for people who feel like sometimes, you know, they've got some superstitious belief that, okay, maybe someone sitting somewhere that's really doing them, or what do you think about that? About people who feel, okay, I mean, my house people have gotten me, or they've decided to finish me, you know, from where we come from. People have got all those kind of beliefs, yeah?
We are... sorry, but with where we're coming from, it looks like with every condition we have something we're pertaining to. And I want us to know that that is not what you have to do. Even if you think it's from your family or something, just go to the hospital. Rule that one out first.
Okay.
Before you start talking about your superstition, this blah blah blah. No.
Yeah.
Just rule out that one.
For, you know, they will be able to save the situation rather than sitting down and believing that, yeah, okay, good.